Medical Intuitive Insights with your host, Dr. Gloria Warren, is a program that presents topics on medical intuition, holistic opportunities outside of mainstream society, and scientific research as applied today. Topics range from online intuitive readings to interviews unveiling alternative healing modalities and discussing them with inspirational leaders. Dr. Warren is the bridge within holistic arts while stressing the balance between the spiritual and physical self. So now, please welcome the host of Medical Intuitive Insights, Dr. Gloria Warren.
Is hair part of your identity? Can confidence survive hair loss? And what causes and treats hair loss? Welcome to another edition of Medical Intuitive Insights. I'm your host, Dr. Gloria Warren, and today we are going to discuss a condition that affects millions of people around the world, yet it's often misunderstood. When most people hear the word alopecia, they think about hair loss. At least we'd hope. But for those living with alopecia, the experience is often much deeper. It can affect confidence, self-image, relationships, careers, and emotional well-being. Hair is closely tied to identity and self-expression, making its loss far more than a costume or cosmetic concern. Today, we're going to explore both the science and the human experience of alopecia. We'll discuss its causes, the different forms it can take, available treatments, and exciting new research. Just as importantly, we talk about the emotional and social challenges individuals and families may face, and the many reasons there is hope. Joining us today is Dr. Corral, who brings us valuable insight into the social and emotional dimensions of alopecia. As a life coach, he is phenomenal, I'll tell you that now. Together, we'll examine how understanding, support, and resilience can help people move forward with confidence and optimism. So what is alopecia? What does it really mean? Before we begin about treatments and research, let's start with that simple question. So most people have heard of the word, but many don't realize there are several different types of alopecia, each with its own causes and treatments. It's not a one-stop shop. One of the most important things is for our viewers to understand that alopecia is not a single disease. It's a group of conditions that can affect many age, genders, or backgrounds. It's not prejudice, is it? While the physical symptom may be hair loss, the underlying causes and personal experiences can be very different from one individual to another. Hair growth in simple terms. Hair grows from tiny structures called follicles, and when those follicles are affected by genetics, the immune system, hormones, medications, stress, or other medical conditions, hair growth may slow, stop, or even become permanently altered. It can be from breakage, separated from the hair root. Broken shaft may appear as shorter, uneven pieces. Fraying or loss concentrated where heat, chemicals, or tension are greatest. Follicular loss may show reduced density from the scalp. The distinction matters because conditioning, a damaged shaft, cannot treat an autoimmune follicle. An immune medication cannot repair the shaft fractured by heat or chemicals. So before we get into more of that, I want to welcome Dr. Corral, Mike Corral. Welcome, Dr. Corral. How are you?
Thank you, Dr. Warren. Thank you for having me. Doing well.
So when somebody first begins losing their hair, what are some of the emotions they commonly experience?
Well, the biggest thing I think that hits everyone is the dread. Some people worry about it before it even happens. And that can cause problems in and of its own. In my family, my dad lost his hair early, and my my older brother lost his hair early. And when that happens, we all begin to imagine, what if that happens to me? both of my sons, two of my sons, lost their hair
Mhm.
in their 30s. Fortunately for them, it was trendy to have no hair. I remember
Yeah. Yeah.
some kids, they're I call them kids, but they're in their mid 30s, shaving their heads, even though they had a full, healthy head of hair because it was the trend to go bald, and it became a thing. So
Hmm.
I think attitude has a lot to do uh, with uh, how we present ourselves and how the hair looks on our body. But we're not just talking about hair. We're talking about a lot of other conditions, as you mentioned before, with alopecia. And so there is a lot of fear and anxiety and different things that are associated with that kind of loss because of the devastation that it can bring.
Hmm. I'm sure, like, embarrassment, now that I believe the bald head is still in trend thanks to wrestlers and some of the sports
Yes.
stars out there. So I think the embarrassment is a lot less, especially if they just bite that bullet and just shave their head. I mean, I remembered seeing somebody not too long ago when they were wearing a toupee, and it's somebody I've known for decades. And I knew he was losing his hair and was wearing a piece before, as they would call it. And I looked, I said, you know what? You look better without it. Take it off,
Yes,
because
we will. Yes.
as a society, we're just getting to be so attuned to seeing a bald head.
Yes.
He actually does look better without any hair. So he's like,
Yes.
"Really?" I'm like, "Yeah." And he goes, "Oh, because I thought, and I said, "No, that's old school. Take it off. Just forget it."
Oh, yeah.
Because you noticed his face was bigger and brighter, and it's just his whole face lit up without the hair that and I guess some people can just pull it off, and he was one of those lucky ones.
Yeah, for
So,
sure. There are
you know,
certain people that look better
mhm,
bald than other people, in my
yeah.
opinion. I remember the first thing I did when my sons started losing their hair is go to the mirror and look and try to imagine myself with no hair. And
Oh,
I made the decision I'm not a good candidate for being bald. I don't know what I would do in that case, except ultimately if it did happen. Uh, my decision would be to own the story, to know
right.
to tell the stories first to myself. What is happening? Why don't I have hair? Is there something I can do about it, or is there nothing I can do about it? And then make my
Mhm.
decision based on what the answer is. If there's something we can do about it, then let's do it. If there's nothing we can do about it, then let's embrace it and make it a part of our story and how it affects us today.
Yeah. I know this is something that affects everybody. And I know, no matter what standing in life you have, but also male, female, it's irrelevant. I remember being so sick a couple of years ago, a few years ago, and I started losing my hair up here in this area really fast. And I was so drained and under so many different stresses of life. And there are things that I did that actually worked. So thank goodness for modern science. We do have options here, and some options are centuries old. So
Mhm.
we'll get into that in later on in the show. So denial. I was in denial at first, and then it started getting worse, and you could start see-throughing some of the hair. And I'm like, oh gosh. So I ended up biting the bullet on that one. And then isolation. I think that's something people start to do when they don't realize that there is something that can help them.
I agree. The thing is, it it takes us by surprise, and when it takes us by surprise, we don't know how to face the public. We don't know how to face our family. We don't know how to face ourselves. And that's the most I don't know, drastic decision we can do is to isolate
Yeah.
ourselves, emotionally, physically, socially. There are many ways that we isolate ourselves. Some of
Yeah.
it is paired with denial. We try to deny that it can be happening to us, or we try to deny that we're even afraid of what it's going to mean for us. Those two
Hmm.
things kind of go together. We don't allow people to talk about it, like when you were like uh, when people wore toupees back in the day. You didn't
Right.
talk you didn't talk to a person about it. If you saw it, if it was obvious, you didn't mention it. It was disrespectful, it was rude because you didn't know how they felt about wearing a toupee. Things may be a little bit different today, and sometimes people's decision is actually put out there with intention because they want people to know, what's going on with them, which is a healthy
Mhm.
decision. I think the most plaguing, Dr. Warren, of the reactions is the uncertainty. Uh, for us, not knowing where this is going to go, how it happened, could I have prevented it? What do I do about it now? Not knowing is probably the biggest, I don't know, probably the most devastating effect because it leaves us in a place where we can't actually make a decision. We don't feel empowered to make a decision with confidence, knowing that there could be some hope. In either
Yeah.
case, the best thing to do is to face the truth about it. Ask yourself, where did it come from? Why did it
Mhm.
affect? And what can I do, or what can I not do? And from that point, begin to make the changes and take the steps towards feeling better about what's going on.
Yeah, I know like many people tell us that losing their hair changed the way they saw themselves, and that gets into identity and why the hair had such a profound emotional impact on them
Sure.
personally, as well as, saddened to say, it does affect the family sometimes, especially if people are going through chemotherapy or something, sickness or whatever. Um, the whole family is and can be affected by that. See the
Yep.
person they love going through these stages. But I don't know, other than identity though, what do you think the view of people, how do you think it affects them in other ways?
Well, there are so many other ways it can affect us culturally. It can affect
Mm.
our gender identity, our sexuality, our ability to feel sexy, if you will, um, and our confidence. Absolutely, and the reason behind each of those varies. It varies in culture. With um, some cultures, I know the Native American culture has a profound regard for your hair and cutting it, whether you cut it or not. And not cutting it you know, is is
Mhm.
a form of respect and honorable.
Yeah. I
Losing your, I'm sorry, go ahead.
Oh no, finished.
No, but that for something as cultural as that, it's a lot more difficult to accept than if it was in open society where it's just a matter of how you look at it. It's a matter of how you address it and present it.
Yeah.
So social acceptance is another one. We want to be accepted. We want to be accepted in just about every circle that we present ourselves, that we find ourselves, and we don't know exactly how it's going to be accepted or addressed or seen. So those are all big things that they actually all contribute to the idea of uncertainty. When we don't know how it's going to be accepted, um, we feel uncertain.
I know with me, I grew up with women saying that your hair is your crowning glory. And that always, don't cut your hair. That's your crowning glory. Make yourself look feminine and sexy and all this other things. And when I started to lose my hair, I was like shell shocked. I was like, no, I don't want to have short hair, you know? So it was a very challenging time for me, social events and things of that nature. But, even work confidence started to change.
Yeah.
So, whether someone loses a small patch of hair or all of it, the emotional experience should not be minimized. Friends and family may see it only as a physical change, but individual may be grieving a loss of part of their identity. So we're
Sure.
going to take a short commercial break. When we come back, hair loss causes treatments hope, and we will go on to the next section. Stay right there. We'll be right back.
Mike Zorek, a three-time California state champion in Greco-Roman wrestling at 114 pounds. Mike, blind since birth, was born in Hartford, Connecticut. He was a six-time national placer, including 2 seconds, 2/3, and 2/4. He also won the Veterans Folk-Style Wrestling twice at 152 pounds. In all these tournaments, he was the only blind competitor. Nancy Zorek, a creative spirit whose talents have taken her to the stage and into galleries and exhibitions in several states. Her father, a commercial artist who shared his instruments with his daughter and helped her fine-tune her natural abilities, influenced her decision to follow in his footsteps. Ms. Zorek has enjoyed a fruitful career doing what she loves. Listen Saturday mornings at 12 Eastern for the Nancy and Mike Show for heartwarming stories and interesting talk.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of the Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on the Caring Generation and PamelaDWilson.com.
Welcome back to Medical Intuitive Insights. I'm Dr. Gloria Warren, and today we're discussing alopecia, hair loss, causes, treatment, and hope. Now we're going to delve deeper into causes, diagnosis, and warning signs of alopecia with the educational and life coach perspective of Dr. Michael Corral. We have defined the major forms of hair loss. Let's explore what the body may be communicating and how qualified clinicians identify the cause. So, hair loss may be a primary condition, or it may be a clue to something happening elsewhere in the body. The timing, the pattern, the symptoms, medical history even, medicines, nutrition, hairstyle practices, and family history can all help form the clinical picture, that is. Timelines also are involved, childbirth, high fevers. I mean, the list goes on and on. Potential contributors, the genetic sensitivity and aging, especially in androgenic hair loss, autoimmune activity, especially in alopecia areata, and some inflammatory scarring disorders, major illnesses, surgery, intense psychological stress. That was my cause right there. There's so much involved, even thyroid conditions, weakened rapid weight loss, weight gain, restrictive diets. We can go on and on. What do you think are the most common or things that people can do for healing and coping and building resilience, Dr. Corral?
I think resilience comes from the ability to foresee what is ultimately going to happen with this. We get to be a deciding part of what happens, and we don't always realize it. Sometimes we think we're at the mercy of our audience. The thing to remember is that we own our own story, and our story, in all of its truth, can actually be a help for someone else. It can actually bring light to a subject that other people are not enlightened about. But especially when our identity is tied to our image, as I was discussing a couple of minutes ago, we run a greater risk of losing something that we consider vital to ourselves. Our image is what we project. And if our image is created based on what we feel other people want to see or identify with or accept, we're not being as authentic as we can. If our image is a clear reflection of our story, that that actually becomes a whole other ball game, because what it does is draws people into who we are as a whole person and what our circumstances happen to be. So whether it's permanent hair loss or temporary hair loss, whether you're going through cancer treatment, whether you're going through a stressful time in your life, if we can own and embrace and share our story, it gives us that authenticity, it gives us that respect, and it also gives us the reverence that sometimes may be lacking in our life. So the bottom line is we may not have all the detail and all the science behind our condition, but our attitude about our condition and our attitude about the condition of others is key in keeping us together, uh, both as an observer or someone who may be struggling with such an issue, and as someone who is struggling ourselves in the subject of such a struggle. Um, our whole attitude towards everything can be a big relief for what follows next.
I love that you said that. So basically, our ourselves and our own script can actually change our approach towards the situation. So knowledge empowers us, support strengthens us, and hope helps heal us. By the way, this show is not to replace a doctor or health practitioner. If you have sudden hair loss or have had it for a long time, maybe if you want to find out what it is, go see your medical professional of your choice. It's up to you. We are not a supplement for that. We are just giving you information that you can take back to your medical professional, and together you may be actually capable of figuring out what's going on. So, yeah, I'm gonna just mention some of the symptoms that deserve prompt evaluation. And I say that because so many things can cause this situation of losing hair. So sudden patchy loss, like a clump fell out here and a clump fell out there, or rapid progression of shedding. Let's say you started to lose hair and all of a sudden it's like 10 times faster or 3 times faster. Burning, definitely. Pain, obviously. Itching, that's a sign too. Redness, scales, bumps, pus or crusting at the hair shaft, a shiny scalp or disappearance of visible follicle openings. It can suggest follicle scarring. Loss of eyebrows or lashes is a symptom as well. Nail changes, hair loss with other systemic symptoms, hair loss in a child, hair loss causing severe distress, withdrawal, anxiety, or depression. You know, there's so many different symptoms and so many different practices on what you need to do for them, that you need to identify why it's happening. Is it hormonal? Oh, who knows? Well, maybe go to the doctor, get some blood tests. Maybe you need to be examined. Your scalp needs to be examined. See what's going on. Is it fungus? I mean, there's so many different ones. We'll get back to that in the next quarter, though. In the meantime, equity in diagnosis. You know, I understand that there was a study, and they found in Black women. Was that you I was talking to about the equity in diagnosis? And if so, can you tell us more about it? Some things that can cause hair loss?
Well, I'm not sure. Well, it wasn't me that you were talking to about it before,
Okay.
but there are some cultures that where it is more prevalent and is more likely to happen, depending on a lot has to do with diet, cultural differences as far as how they regard it, and a number of a host of other things. But the bottom line is that when we know that we are at risk, that's the first sign for us to begin to take action. If you know that your culture is at risk, you can begin to take action by doing some research for yourself and moving along in that direction and gathering information about uh, solutions that have worked for other people in the same culture with the same symptoms and uh, similar conditions. Of course, with the guidance of your medical professional. Uh,
Right, right. So I understand out of that conversation, that was probably another doctor I was talking to, but hair texture, they did a study on African American women, and they seem to have um, cicatricial alopecia, which is disproportionate and affects Black women more so than any other culture, and many begin at the crown up here. But here's what they found: hair texture, hair styling practices. Having your hair pulled back too tightly, the braids against the scalp being done too tightly, uh, access to dermatological care and clinician trainings to recognize disease across all skin tones can affect diagnosis. So this type of alopecia is disproportionately affects Black women because of their hairstyles and may begin at the crown because it can scar, and early treatment may preserve follicles. You know, I gotta hand it to them. At least they try to see professionals to do their hair, or people, culturally, people in their family, which is wonderful. I wish my family would do things like that. That they're used to seeing healthy hair, so maybe they'd recognize it right away and maybe they can do something about it. But that's with all cultures.
yeah,
So I'm just very grateful they did that. Um, so there's laboratory testing that can be done. A clinician may examine the patterned scalp, see what closely it looks like, perform gentle pull tests, inspect the nails also, which can show sometimes what happens on the scalp. Order lab tests, a scalp biopsy could be done. A dermoscopy magnifies the scalp and follicle openings, allowing trained clinicians to see features that are difficult to appreciate with the unaided eye. What's going on there? You know, the hair pull test can estimate whether active shedding is occurring or perhaps it has stopped. Who knows? That's one of the tests. Photographs can be taken with consistent lighting and positioning, can document change over time. That's really important because you forget. It's like I took a picture of my scalp and then 6 months later I took another picture here and I was like, oh, it's working. But if I just looked in the mirror, I couldn't really tell. But when I saw the two pictures and compared them, I was like, my gosh, 50% of it is gone. More 50% more of my hair is back. Very important. Take photographs.
absolutely.
And yeah, if fungus is suspected, a clinician may examine or even culture the hair and scale on the scalp. If scarring, though, that's something that's not good. Alopecia, it's possible. A biopsy taken from an active edge can reveal pattern and location of inflammation. Lab testing, there we go again. History of thyroid dysfunction, perhaps. Iron studies, ferritin studies, identify anemia. These can all be causes of alopecia. Ordering every possible test can lead to incidental findings and unnecessary expense, while skipping indicated testing may miss a correctable contributor. So you have both sides of that rainbow. You can get too many tests and it's too confusing, or you can have an exam and let the human eye, along with microscope and things, examine that scalp first and then optimize what tests need to be done.
Absolutely, I agree. That focus, having narrowing it down so that you know what to focus on when you're doing your research
Right.
is
So
is
the
key.
cause of alopecia takes into account the hair loss pattern, timing, and scalp health. It tells an important story. When we return, understanding treatment options from local therapies to newer immune targeted medicines, and why the right treatment depends on the right diagnosis. Please stay with us. You're not going to want to miss this. Me, Dr. Gloria Warren, and Dr. Corral will be right back.
Master of words, powerful player, What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life. Author, radio show host, and coach John M. Hawkins reveals strategies to help gain perspective, build confidence, find clarity, achieve goals. John M. Hawkins' new book, Coached to Greatness: Unlock Your Full Potential with Limitless Growth, published by iUniverse. Hawkins reveals strategies to help readers accomplish more. He believes the book can coach them to greatness. Hawkins says that the best athletes get to the top of their sport with the help of coaches, mentors, and others. He shares guidance that helps readers reflect on what motivates them, rediscover and assess their core values, philosophies, and competencies, find settings that allow them to be the most productive, and track their progress towards accomplishing goals.
Welcome back. This is Medical Intuitive Insights. I'm Dr. Gloria Warren. Today, Dr. Corral joins me for his perspective, education, resilience, and life coaching. While we continue examining alopecia, its causes, treatments, and reasons for hope, we're going to look at treatments now and scientific progress. You're going to want to keep this video because this is going to help you later in life, or maybe a family member or a friend, and they're going to need to hear these things. So treatment goals differ from one cause or to another. There's some people who would need to put something on their scalp. Somebody else maybe needs to change their diet. It's very important to get diagnosed correctly. So see your medical provider of your choice, get diagnosis, and if it doesn't work, you may even get a second opinion, but there are things that can be done. So sometimes the aim is to restart growth. Sometimes it is to reduce inflammation, preserve the remaining follicles, then correct the underlying condition, or help a patient navigate chronic or relapse disease. No single product treats every form of alopecia. The treatment conversation should include 6 questions, and I'm going to give it to you right now, right here. 1, what exact diagnosis are we treating? 2, what outcome is realistic? 3, how long may improvement take? 4, what are the common and serious risks of treatment? 5, what monitoring is needed? And 6, what happens if treatment is stopped? Hair grows slowly, so photographs and standardized measurements are often more informative than a day-to-day inspection. So I'm going to go through a quick list here. I'm just letting you know, Mike, just you may like this too for people that you know, but cause of and specific treatment. 1, pattern hair loss. Topical minoxidil is often widely used. Selected patients may discuss oral minoxidil or antihydrogenic approaches with a qualified prescriber. Oral minoxidil for hair loss is off-label in the United States and requires individual risk review and monitoring. Don't just take somebody else's medicine here. Minoxidil has side effects. Please review that with your doctor if that's what they want you to take. Localized alopecia areata. Corticosteroids may be applied, injected, or occasionally used systemically. Minoxidil may help maintain regrowth in some treatment plans, but maybe not in others. Extensive alopecia areata. This is another one. Immune-targeted treatment may be considered after evaluating severity, age, medical history, risk, and patient goals. Then we have this, let me see if I say it right, Talagen, effluvium. Clinicians identify the correct the trigger when possible. Recovery often depends on time and restoration of normal cycling. Now we have traction alopecia. Removing tension early is essential. Long-lasting traction can become permanent. This was my problem. Part of it. Now we have scarring alopecia. Controlling inflammation quickly is the priority because it can destroy follicles. The inflammation can't. And then you get in a cycle. And this type of alopecia cannot be restored. So you got to catch it early for it to do any good. Treatment options may include corticosteroids, topical medications, oral medications, JAK inhibitors, platelet-rich plasma. Yes, hair transplantation where appropriate, and clinical trials. I talk about platelet-rich plasma. They take your blood, they take out a red topper tube, and then they take it, they let it clot, they put it into the centrifuge, they spin it down, you end up with that clear fluid there. Sometimes that clear fluid will also help. It's being used in other countries right now. It's wonderful to help heal other things in the human body. I had done twice to me, once on my foot, once on my back. Amazing. I don't have back problems now. I just try to be cautious. My foot is fine. I love it. So, that's amazing. There's other drugs too, like ritlecitinib and duroxetlitinib or whatever for adults, adolescents, 12 years and older. These medications are not ordinarily hair medications. They alter immune signaling. And like I said, it can be caused from immune condition. Clinical trial percentages describe groups, not density. A statistically significant result means that the difference was unlikely to be explained by chance under the study design. It does not mean every participant regrew hair. Please keep that in mind. Every human being is unique to their own human body. Not everyone reacts in the same way. Culture has a lot to do with that, actually, as well as just being human. Shared decision making places the trial results beside the individual patient's disease burden, health risk, values, and tolerance for monitoring. So the scientific study, there's a lot of different phase 3 trials randomly assigned adults with severe alopecia areata and a placebo. At 36 weeks, significant greater portion is treated. 20% or less scalp hair loss. You can go on and on. You can check, use Google Science, find out, put in alopecia research studies, and you'll get a whole list of scholarly research studies. So there's other things you can do, like camouflage. There's the spray you can use. You can use a hairpiece. I know, like I look at women, and my problem actually got me started in this. I look at women newscasters on TV, and you're like, oh my gosh, she's wearing a wig. And how I tell is, gee, you don't see that part coming down to the scalp here. It's dark. And it's like, wow, their hair's always so perfect. Yeah, a lot of them are wearing wigs. I'm not going to say who, but it really makes you realize how common it is in society and how many people actually do wear hair pieces. And that's another cultural thing as well. You can find certain cultures wear more hair pieces than others. Remember back in the 60s, my mother, she's a brunette. She came home with a blonde wig on. And I'm like, is that you, Mom? But it was the thing. It was the fad back then. And some cultures, they do it all the time. So there's no shame in that. Have fun with it.
Absolutely.
So, yeah. So emotional healing, Dr. Corral. Are there any things that any techniques or therapies that you would suggest from a coach standpoint?
Well, we know that medicine heals the body. And for some people, movement is medicine. For some people, for all of
Mm,
us, movement is medicine, food is medicine. Relationships can be a good medicine as well. The way we do our relationships has a
mm,
profound effect on the way we feel, the hormonal production, the oxytocin in our bodies, the release of these natural chemicals in our body that make us feel good and make better decisions. Um,
yeah.
and it's kind of a catch 22. You know, you do the right thing and the right thing begins to happen, and you can get a cycle going in that way. But healing often involves healing the mind as well. It's important to have that mental resilience and to use the power of your mind, use your gut, use your intuitive ability to help yourself assess what's going on. I was telling you the story about when I was a kid. As a teenager, I went to a riding school and ended up with a summer job at the racetrack riding thoroughbreds. And one thing I noticed was that all the jockeys were balding at an early age. And I, in my own mind, attributed it to the fact that they wore their helmets not nonstop. And for me, I figured it
Hmm.
had to be a connection. I refused. You know, I don't know if it worked, but I also noticed that every athlete that wore a baseball cap all the time um, was more likely to be bald at an early age. I think going with your gut is always a good precaution, as it will help you to find even more scientific proof for or against whatever it is you're questioning. So there's an emotional dimension, and that needs to be deeply considered as well.
Yeah, you mentioned the helmets. I know in the construction field, leave it to me if you even bring that up. The men that used to wear, or even women that wore the
Hard hats.
helmets, hard
Hmm.
hats, right? It has a real wide band that goes around your head here, and
Yes.
I noticed that some of them, the ones that wore them all day long, they were thinning in with their hair. It cuts off the circulation, so the hair follicles can't get the oxygen and nutrients it needs to. By the way, nutrition, diet,
Uh,
definitely a part of this equation. Um, but it's just so many things that you don't really think of causing those problems, and yet they can. So you're right, the emotional dimension, cultural, mind, body, spirit, let it all be on the same platform. Don't just ignore one or the other. Don't ignore your body, don't ignore your mind, and don't ignore your spirit, your soulfulness, and things, your purpose for being here. Um, but also remember there are people out there that can help you, like Coach Mike. He's available uh, for counseling or peer support. There's mindfulness training. There's a lot of spiritual, with the Tibetan monks, there were a lot of spiritual practices that they do that actually help to heal the body as well as the mind. I mean, meditation, even yoga, biggie, huge. Just walking outside, putting your feet in the grass and just standing there, breathing, deep breathing exercises. I've said this before, I'm going to say it again. I do Qigong and I mix it in with yoga and deep breathing, and it's my peace on earth and goodwill to me, obviously, because that's what I
Absolutely.
need. Yeah, it's wonderful though.
Yeah,
So,
talking about,
yeah, go ahead.
sorry, I was going to say, talking about the emotional connection, but you know, it's hard to be emotional without some kind of a spiritual part to it. Our mind and our soul and our heart are all connected in one way or another. Um, but when you have somebody to talk to share with, you you actually restrict the concept of shame from taking place. They
Mm,
say that shame thrives in secrecy. Um, if we can at least have one person to share our secrets with, um, we have already disarmed the idea of shame coming into our life. Shame can
nice.
be devastating in many, many different ways.
So we are getting close to our third commercial break here. Scientific advances are creating real options. Safe treatment begins with accurate diagnosis and decision making. By the way, if you have extreme sadness, anxiety, avoidance, please Seek a person, licensed mental health care practitioner immediately. Support is essential. So when we come back, we're going to give you a list of myths versus facts, as well as examining nutrition, stress, hair, and emotional road toward hope. We'll be right back.
Are you struggling to care for elderly parents or a spouse? Do you wonder if being a caregiver is making you sick? Are you worried about taking time off work to care for elderly parents and balance work, life, and caregiving? Has caregiving become exhausting and emotionally draining? Are you an aging adult who wants to remain independent, but you're not sure how? I'm Pamela D. Wilson. Join me for the Caring Generation radio show for caregivers and aging adults, Wednesday evenings, 6 Pacific, 7 Mountain, 8 Central, and 9 Eastern, where I answer these questions and share tips for managing stress, family relationships, health, well-being, and more. Podcasts and transcripts of The Caring Generation are on my website, PamelaDWilson.com, plus my caregiving library, online caregiver support programs, and programs for corporations interested in supporting working caregivers. Help, hope, and support for caregivers is here on The Caring Generation and PamelaDWilson.com.
Master of words, powerful player. What life-changing words can Dr. Janet Smith Warfield pull out of her magical toolbox that just might mysteriously open a door you never knew was there? A door to free yourself from fear forever. Transform your rage into right action. Release your guilt. Position you into a life of freedom, purpose, passion, power, and peace. All quite suddenly, unexpectedly, and almost miraculously, with no effort on your part. Join Dr. Janet on Dancing with Words, Dancing with Wisdom, as she and her guests show you how words map our experiences, immersing you in a sound bath that relaxes your muscles, opens your mind, and supports you in co-creating your extraordinary life.
Welcome back to Medical Intuitive Insights. I'm Dr. Gloria Warren, joined by life coach and educator Dr. Corral. In our final quarter, we are bringing together the medical and human sides of alopecia. So we're going to talk more about the whole person first. And in this case, we're going to discuss nutrition, support, and hope. Good nutrition supports the health of the entire body. You cannot have healthy hair without good nutrition. If you eat junk food, but your hair is healthy, well, maybe there's something in that junk food that keeps it going, including hair follicle nutrients. But it's not a cure for alopecia, nutrition by itself. A balanced diet that provides adequate protein, iron, zinc, vitamin D, and other essential nutrients may support healthy hair growth when true deficiencies are present. However, excessive supplementation can also be harmful. So vitamins and minerals should be taken under the guidance of a healthcare professional. Please just tell them what vitamins you're taking. And, if you see that there may be a controversy in that, don't expect your doctor to catch it. Make sure to mention, hey, I was told if I take too much of this, this can happen. And it may bring it to his attention. Well, wait, yeah, that is a problem. Lie low on it. So let's first talk self-care. Coach Mike, what do you think about self-care?
Self-care is a very important part of everything that we all do. It's important to have a regimen of self-care, beginning first thing in the morning. What do you tell yourself as you open your eyes? Are you grateful? Are you worried? Those are little things that we want to look for. A good red flag is if you wake up and you're worried, that means that you didn't go to bed resolved and you didn't clear your mind. So a good regimen is important in any type of self-care, whether it's physical, mental, emotional, or even social. The bottom line is to have a plan and stick to your plan and monitor your plan because it can be altered down the road. You'll notice that because we're dynamic people, we're growing and changing all the time. So one plan is not going to be good through the duration of our life. It's going to need to be altered. So as far as self-care goes, that's what I recommend. Have a regimen. Know what your outcome is, and begin piecing it together from there.
I love it. So the self-care, I know can do things like you could put things on that list like loosen your braids before you go to bed and ponytails, extensions, weaves, and heavy accessories. I know weaves are really expensive. So I know that I don't get that. I don't know much about it, but I know the people that do, and they know quite a bit more than I could ever imagine. Limit excessive heat and harsh chemical processing when breakage or traction is present. Avoid crash dieting, adequate diet, use stress management practices, overall health coping, natural supplements. So, by the way,
A
I'm
good
going to give
scalp.
you a key of ancient
Oh,
medicine for alopecia, but I'm going to wait with that just a little while longer. Saw palmetto. There were I was so excited, 5 random clinical trials and 2 prospective cohort studies demonstrated positive effects of topical and oral supplements containing saw palmetto 100 to 320 milligrams a day among patients with androgenic alopecia, and 60% improvement in overall hair quality, 27% improvement in total hair count. So, I mean, this goes on and on. You can pull it up. You pull up research studies, just go to Google Science or Google Scholar, I think. You pull up different scientific studies, geranium oil, lemon oil, pumpkin seed oil. They tried them all. Ginseng, onion juice. The 2 from ancient times, rosemary oil.
huh.
Rosemary oil is said to take away some of the fungal problems that you may have on your scalp, heal some of the hair follicles. Not an all encompassing thing here though. So be very careful. And what I use, castor oil, another ancient thing.
Absolutely.
So
I've heard of
we have
that.
lifestyle. Let's do the myth and facts. Myth: cutting or shaving hair makes it grow back thicker. False. Cutting changes a blunt appearance of the shaft above the skin. It does not increase the number of hair follicles. You can't just miraculously have more hair follicles. Myth: every case of sudden hair loss is caused by stress. It's caused by many things. We went into that. Myth: alopecia areata is contagious. It is an immune mediated condition, folks. It is not contagious. Another myth: one supplement can correct every type of hair loss. Not true. We've gone through it, more than one kind. Myth: natural always means safe. Not true. I'm an herbologist as well. Natural doesn't mean safe. You can burn your skin with different oils and on and on. And scalp pain, burning, may be ignored until bald area appears. That's a myth. Fact: cosmetic camouflage can be a part of a compassionate care. So, Coach Mike, how can they get a hold of you?
I can be reached at olcp.life, www.olcp.life. You can call me directly, 508-648-0825, and I will answer the phone myself. It won't be
Right.
a
So,
it won't be a service.
keep in mind, hair may influence how we look, but it never defines who we are. Strength, character, compassion, and courage. That's what really counts, folks. So, I'm Dr. Gloria Warren there, but for the grace of God go I. May you walk in good health. Thank you, Dr. Corral, by the way. May you walk in good health, renewed hope, and abundant blessings. We'll see you next time on Medical Intuitive Insights. Bye.
This has been Medical Intuitive Insights with host Dr. Gloria Warren. Tune in each week as Gloria shares over 40 years of experience and yearns to provide knowledge derived from intuition and research. Wednesdays, 2 p.m. Eastern.